I just want to say welcome to those of you signing in to our patient education series. I'm Dr. Peretta. I'm one of the breast surgeons here at Huntsman Cancer Hospital. The goal of this series is to present topics that are of interest relating to breast and gynecologic cancers. And today we're really fortunate to have Dr. Sonal Oza presenting. Dr. Oza is board certified in physical medicine and rehabilitation with a special focus on cancer rehabilitation and optimizing physical function for patients through the whole continuum of cancer care. Today, Dr. Oza is going to be speaking to us about optimizing physical health and fitness in cancer. It's a marathon and not a sprint. I think if we can have her take over when ready, Sonal.
Yeah, is everyone able to hear me?
Yep.
Perfect. All right. So thanks so much for having me here. My name is Sonal. I'm one of the rehab physicians here at Huntsman. So we'll get started with the presentation. And next slide, please. All right, so here at Huntsman, we have a program here called RISE, and it stands for Rehabilitation, Independence, Support, and Empowerment. And we are what's called a multidisciplinary rehab team, meaning that we're made up of PM&R or rehab physicians, also our therapists on site. So that includes physical therapy, lymphedema therapy, pelvic floor therapy, occupational therapy, and cognitive therapy to help with memory and concentration. And we have a neat program here called the POWER program, which is a supervised exercise program. So I'll come back to explain a little bit more about our services, but I wanted to introduce in what context I'm presenting from today. Next slide. And so what is PM&R? It stands for Physical Medicine and Rehab, and it's a specific medical subspecialty where our goal is really to identify anything that's affecting your ability to function, meaning carry out your daily activities, engage in exercise. So for individuals with cancer, it could mean fatigue, weakness. It could mean a nerve injury as a result of where your tumor was located, or the type of treatment you had, or it could, if you have cancer that spread to your bones and that's impacting your ability to do things. So our job is to identify what the cause is of what's preventing you from functioning, and then coming up with a plan so you can do what's important to you. Next slide. And so patients with different cancers affecting women, breast cancers, gynecologic cancers, these are some of the things that come up when they first meet me in clinic. The last questions such as, when will I feel normal again? Next. They'll say, these symptoms are a constant reminder of my cancer, whether it's the fatigue, the numbness, the tingling, changes in muscle strength or endurance. And next. They'll say, I want to be able to camp, to hike, to ski. They're either going through treatment or they finished up treatment and they want to go back to a sense of normal life again. And next. And for some patients, they also want to be able to return to work. And then some of our patients continue to work as they're going through treatment as well. And next. And they'll say things like, I want to be able to hold my child. I want to be able to, hold my grandchild, be able to play with them. So their demands are not unreasonable, and we should have a way to help make these things easier. And next. And this is something I hear pretty frequently across diagnoses. They'll say, I'm very grateful to be alive. They're so thankful to their oncology team. But then they'll remark, I didn't realize this is what I would have to live with. And so that's our job as your rehab team, is to help those symptoms become less of a reminder of what you're going through or what you went through. And next. And so in the context of exercise, how does this relate to cancer and rehab? So research over the past, more so 5-10 years, has really shown that individuals with a cancer diagnosis should try to exercise during and after treatment. Now, the national guidelines are a little daunting because they recommend 150 minutes of exercise a week that's moderate intensity, and I'll get into that, and then 75 minutes of vigorous intensity exercise. And that's a lot of minutes in a week, especially if you're trying to coordinate all these other medical appointments. Next. But we still harp on exercise because regular physical exercise has been shown to improve a number of cancer-related symptoms. Fatigue is a common one across diagnoses. Physical function. So what that means is ability to walk, dress yourself, carry out your day-to-day activities. It can also help with symptoms impacting our mood, such as depression, anxiety. Exercise has also been shown to improve lymphedema, which is swelling that can occur after lymph node surgery that can affect the breast, the arm, the pelvic area, and legs. And it can just impact our overall quality of life. Usually when we exercise, we feel good. Our mood is heightened. Next. And so the 150 minutes or even 75 minutes of vigorous intensity can sound unreasonable at times and maybe unachievable. But what we've learned over the past couple of years is that for individuals with cancer, even getting a total of 90 minutes spread out throughout the week can help improve those symptoms of fatigue, anxiety, our overall physical function. And I think the even more encouraging point that's come out of that research is that the exercise doesn't have to be in 45 minutes or 60-minute sessions. Even exercising in increments of 10 to 15 minutes throughout the day can still yield these benefits. Next. And so then we get into, well, what does it mean, or what differentiates the different types of intensity of exercise? So if you recall from the previous slide, one of them was 150 minutes of moderate, 75 of vigorous. That new 90-minute recommendation is a range from moderate to vigorous. So you have a little bit more flexibility. So when we talk about mild intensity exercise, next. It's activities such as walking, but walking at a speed of about 1.5 to 2.5 miles per hour. Next. Doing yard work counts as mild intensity activity. Next. And then even things like fishing put you in that category of mild intensity. And then we'll talk about the other types next. More aerobic activity, even yoga, which might seem like a lesser intensity, still qualifies as moderate. Next. Dancing, our patients do Zumba, that counts as moderate intensity exercise. Next. And then more heavy yard work. So if you're digging, things like that in the yard, that will most likely qualify as moderate. And then walking as well, but at a faster speed. Playing tennis counts, singles or doubles. And next. And then walking at a speed of about 3 to 4.5 miles an hour. If you're able to achieve that speed, then you're at that moderate intensity level of exercise, and then cycling as well. And then as we get into vigorous, might be more of what we think of when we're engaging in sports or more, perhaps even more athletic activities. So next. So walking more than 5 miles an hour, so that's a pretty brisk pace. You're getting closer to a jog at that point. Next. And then cycling, but more than 10 miles an hour. And the next, swimming gets you into vigorous intensity of exercise. And next. And then cross-country skiing as well. So those are just examples of activities that classify into these various categories. What you also see here are listed are METs and maximum heart rate. So if you were to see me or one of our exercise specialists in clinic, what we would do is we would calculate your estimated maximum heart rate, and that's based on your age. And then based on that, we calculate a percentage. If we around 50 to 65% is mild intensity, 65 to 75 is moderate, and more than 75 is maximum. And the reason we would do that is for some of you that have, if you have Fitbits or smartwatches, and using our heart rate as a guide to know what intensity of exercise we're participating in can be really helpful and give you that feedback. So we can give you something a little bit more objective to follow as you're engaging in a program. Next slide. And then if you don't want to wear a smartwatch or you don't have a smartwatch, this is this has actually been shown to be relatively accurate, engaging how intense you're exercising. So let's say you're walking, and if you can carry on a conversation with a friend and you think you could sing without feeling out of breath, then you're probably exercising at a mild intensity. let's say you start picking up your walking speed. You can still talk, you can still carry on that conversation, but singing you'd feel like you're a little out of breath, then you're more at that moderate level of activity. And vigorous this is like where you're jogging, you're running, or you're doing some exercise where talking is hard, you'd feel out of breath, and then also singing would cause you to feel out of breath as well. So this is just different techniques or tools that you have to identify to what degree you're exercising at. Next slide. And so a lot of that was centered around aerobic or cardio. We also know that for individuals with cancer, it's important to engage in some level of weightlifting or resistance exercise. When we see this in the context of after recovering from surgery, just because we're not doing as much, we can start to lose some of our muscle mass. If part of your treatment involves receiving chemotherapy or other type of medication, that can also cause us to lose a little bit of muscle mass over time. The upside is that even despite being on those medications, despite being on treatment, we still have the potential to rebuild our muscle strength and endurance. Just takes time and effort. And so we've know in individuals with various types of cancer, if they engage in weightlifting or resistance exercise, we can increase the size of our muscle. That also can translate to improved balance and just kind of coordination. We feel less clumsy. And then it also maintains our bone health. So can counteract the loss of bone density that occurs as we get older. In terms of how often to exercise, they say about 2-3 times a week, and doing about 10 reps of an exercise of the muscle group. So less frequent than what's recommended for that aerobic or cardio level of activity. Next slide. And so what to consider before starting an exercise program, especially, whether you've been recently diagnosed or you've finished up most of your treatment and you're transitioning into resuming more of your typical day-to-day activities. So if you've had the diagnosis of cancer and you've gone through certain types of treatment, that affects other aspects of our health. And so I'll go through these in a little bit more detail on the following slides. So next. So one of the things is surgical restriction. So after you've had surgery, for example, if you've had breast surgery, your surgeon may not want you to lift for a certain number of weeks, or they may not want you to raise your arm above the level of your shoulder for a while. And the same thing with the gynecologic surgeries. They may not want you lifting a certain number of pounds for the 4 to 6 weeks. So when you're in this period if you've had surgery, the recommendation for activity is usually walking. And as you saw, walking is a great form of exercise. You can, even if it's that mild to moderate intensity, a bit more closer to a 2 to 3 mile per hour speed, you're still exercising, you're still reaping the benefits of improving your heart health and improving recovery after treatment. Next. Heart health considerations. So we know that patients who've received the treatments that are listed here on the slide, you might be at a little bit of a higher risk for developing an irregular heart rhythm, or what's called atherosclerosis, which is tiny plaques in the arteries of the heart, or your heart may not pump as well as it used to. And this is something you would talk to your oncologist about to better understand if you personally are at risk. But if you do have any of these conditions, or you've received the type of chemo, adriamycin or Herceptin, or you had cancer along the left side of the breast and that area was radiated, that's something that you'd want to be aware of. And when you're seeing us in clinic, we would take that into account as we develop your exercise program. If you're having symptoms such as chest pain, shortness of breath, heart palpitations, if you're exercising on your own, those are things you definitely want to communicate to your oncology team. Next. Sometimes we can develop what's called osteoporosis, which is when the density of our bone becomes more brittle. This is common in women, especially once we're postmenopausal. But if some of the medications, such as the aromatase inhibitors, such as anastrozole, letrozole, exemestane, that can cause little bit cause us to lose that bone density a little bit faster than typical. So if you've been diagnosed with osteoporosis by your doctor, that's something that we would take into account when developing your exercise program. We know that it's still beneficial to exercise and to lift weights. We just want to avoid what's called high impact activities. So activities that involve running, jumping, mountain biking, where you have that kind of sudden impact, that can just cause too much stress or force across your bones, and we don't want you to have a fracture. And those same restrictions or precautions apply if you're someone that has had cancer and it's spread to the bones. We want to be safe. We want to strengthen the muscles around those bones because muscles are our shock absorbers, but we don't want to do something where that force or impact is so strong that we cause a fracture. So again, these are things that we would go through when we're developing a program for you. Next. The other thing that can develop in the context of cancer, and mostly with receiving chemotherapy. So if you've received these agents, you may have developed numbness or tingling along the bottom of your feet. And then sometimes this can feel like a burning pain. And you can still exercise with neuropathy. There's actually research showing that exercise might help improve neuropathy symptoms. But if it's impacting your balance, we just want to make sure the exercises you're doing are keeping you safe and not increasing your risk for falling. Next. And then the other one, I started talking a little bit about this before, is if you are on an aromatase inhibitor, which is one of those oral medications, that can sometimes cause muscle and joint aches. At the top of the screen are the two acronyms that we usually use to describe those. And this can almost feel like arthritis, like joint stiffness, pain that's worse in the morning, and pretty symmetric, meaning the right side and left side are pretty equally affected. There are medications that can help improve the pain associated with this condition. But out of the research that's been done, exercise is also something that's been shown to benefit, from walking to swimming, and also resistance or weightlifting exercises. So if you have symptoms or side effects from the medications you're on, exercising might also help reduce some of the pain or discomfort you're experiencing. So kind of multiple reasons to potentially exercise. Next. And then lymphedema is something that can develop after surgery, after radiation as well. And especially if you've had surgery to remove lymph nodes, either in the underarm area or in the pelvic region. And so lymphedema is swelling that occurs. And so years ago, we used to tell patients to not exercise because we thought that that would worsen the swelling. But in recent years, we've actually learned that both the aerobic and resistance exercise might actually help prevent the volume or the size of the lymph from worsening. And it might actually improve it as well. What we've learned, though, is that exercise has to be really gradual and progressive. So what that means is if you haven't been exercising, instead of trying to go and lift 20, 30 pounds, you would want to start with 5 to 10 pounds and then work our way up over several weeks. And that can prevent that limb from suddenly becoming larger, and over time might help control the fluid buildup. Next. And so exercise can help with a number of things, right? We all know it's good for our overall health. It can help with a number of symptoms that we might experience with cancer treatment and the more longer term side effects. And what we do know is that there's benefits to exercising from time of diagnosis moving forward, which can sound kind of counterintuitive, especially if you're feeling pretty fatigued and overwhelmed with what's going on with treatment. Next. So it's pretty well known that we should exercise, but across cancer centers across the country, only about 20 to 30% of patients' rehab needs are met. Less than 50% of individuals report engaging in regular exercise. So we know it's important, but how can we help you get there? Next. And so there are a number of barriers to exercise: fatigue, side effects from treatment, that dizziness, the nausea, time as well. You have a lot of appointments, you have life to live. And then also it can be kind of vague if you're reading or you're being told to exercise, but you're not really sure where to start, or what's safe in the case of your personal history and treatment. And then you also don't want to harm yourself. So these are many cited reasons among women with cancer and what might prevent them from starting or continuing an exercise program. Next. But there are also a number of things that motivate us and facilitate engagement and exercise. In many ways, after a cancer diagnosis, it's a time where we really want to optimize our health and control what we can control. It helps with mood. It can be a place to get that social support if we're exercising in a group setting. And we found that individuals who engage in a more supervised, structured exercise program in a hospital setting are more likely to continue with exercise and feel that it's a beneficial thing to do while they're going through other treatment. Next. And so what do we have here at Huntsman? I introduced the talk with our RISE program. And so the reason that we're multidisciplinary is that we have PM&R physicians here. So if you're experiencing high levels of pain, you have muscle or joint symptoms, you're worried about the neuropathy, you would see one of us first because we want to make sure we have a plan to manage those symptoms. And then we would talk about at what step do we introduce both an aerobic and strength training exercise program. Let's say you've had breast surgery and it's hard for you to lift your arm up, or you've had gynecologic surgery and you're having pelvic pain, you're having low back or hip symptoms. Then we may want you to see one of our therapists first to really focus in on that particular symptom, and then talk about, exercise simultaneously or starting a program once you're finished up. And let's say, you've gone through treatment, but otherwise you're feeling relatively well, maybe just maybe fatigue, then you might be good to just start our exercise program right away, which is the POWER program. So the nice thing is that we have all these services on site here, and then we're here to guide and direct you based on what your symptoms are and what your goals are for exercise too. Next. And so this is just further illustrating the spectrum of resources we have here. We have the physicians, we have the supervised POWER program, and let's say you live further away or, it's hard to get to Huntsman on a weekly basis. We also have virtual group-based exercises too. In our POWER program, you can work one-on-one with one of our exercise trainers, either on site or through a video visit virtually too. And that's been really helpful over the past year. And then otherwise, if you were previously exercising, you have a good idea of how to safely exercise, then you'll just exercise on your own. And then you can reach out to us as needed for some additional guidance. Next. And so I'll go into a little bit more detail about the POWER program. And that is our both on-site and virtual program where you work one-on-one with a certified exercise specialist. And usually how the program works is for the first few months, we ask you to participate about twice a week, and then you graduate to once a week. And then after about 7 to 9 months to once a month. And that's because what we've learned through other research studies is that if you exercise in a program and then all of a sudden we let you go, it's just harder to keep up with it. So that's why we gradually kind of go into more independent exercise. There is an out-of-pocket cost to it. If you spend $100, that gets you a punch pass, and then that gets you 12 one-hour sessions with the exercise specialist. And if there's difficulty making that payment, we're here to work with you to see how we can make the program affordable. And then this is only for that POWER program where you're working one-on-one with a trainer. You can of course see the physicians for some initial guidance and check in with us as you're here for your other appointments. And then those virtual group classes are complimentary or free. And so the final slide here is, if you want to take a screenshot or we can email out this information to you as well, is how to get in contact with us. So first, talk to your medical team. We're really lucky here in that the surgeons, the oncologists, the radiation oncologists are so supportive. And so I'm sure they'd be happy to give you a referral to see one of us. You can call us directly. And then the top link here is the web link to the RISE program. And then if you're interested in those group virtual classes, which are complimentary or free, we have a link where you can sign up and see the schedule and then join based on whenever's convenient for you. And so that's what I had for this afternoon. Please feel free to ask any questions or share any of your experiences.
That was great, Dr. Oza. We really appreciate you taking the time to present that information. If people have questions, it works best to just put it in the chat, and then Dr. Oza can address any questions that you have. I think you did such a good job that it was very clear. So I don't know if you have any questions. I also wanted to note that this presentation will be posted onto the Huntsman YouTube site, so we can refer patients and anyone who's interested to this information in the future as well, which is very helpful.
That sounds great. Thanks for having me here.
Thanks, guys. So I think that will conclude our presentation. Thanks again, everyone, for signing in and joining us.